Welcome back to Datdangdoctor. Let me ask you something. Do you really need vitamin D, or is it just another overhyped supplement in your medicine cabinet? You hear about it all the time. The sunshine vitamin, the bone booster, the immune system's best friend. But is it truly essential, especially for older adults? Today, we're going to dig into the science, the symptoms, and the real impact of vitamin D on your health, and whether skipping it could be costing you more than you think. Vitamin D isn't just a trendy nutrient. It's a hormone-like compound that plays a critical role in how your body functions. Most people know it helps with calcium absorption, which is key for strong bones. But it also influences your immune system, muscle strength, mood, and even how your body responds to inflammation. For seniors, these functions become even more important because aging naturally reduces your ability to produce and use vitamin D efficiently. So, where does vitamin D come from? You can get a little from food. Fatty fish like salmon and mackerel, egg yolks, and fortified products like milk and cereal. But the majority of your vitamin D comes from sunlight. When UVB rays hit your skin, your body starts producing it. Sounds simple, right? But here's the problem. As you age, your skin becomes less efficient at making vitamin D. Add in sunscreen, long winters, and more time spent indoors, and suddenly your levels start to drop. And when they drop, you feel it. Fatigue, muscle weakness, joint pain, depression, and even frequent infections can all be signs of vitamin D deficiency. The tricky part is that these symptoms are easy to blame on aging itself. But often they're signals that your body is missing something vital. And because vitamin D affects so many systems in the body, a deficiency can quietly chip away at your quality of life without you even realizing it. So, how much do you actually need? For adults over 50, most health experts recommend between 800 and 1,000 IU of vitamin D per day. Some people may need more, especially if they're deficient or have conditions that affect absorption. The best way to know is to get your levels checked with a simple blood test. It's quick, inexpensive, and gives you a clear picture of where you stand. If your levels are low, your doctor can help you figure out the right dose to bring you back into a healthy range. Now let's talk supplements. Vitamin D3 is the preferred form. It's more effective at raising blood levels than D2. Supplements come in tablets, soft gels, and even liquid drops. They're generally safe, widely available, and affordable. But it's important not to overdo it. Too much vitamin D can lead to toxicity, causing nausea, weakness, confusion, and kidney problems. That's why it's crucial to follow dosage guidelines and check in with your healthcare provider before starting or adjusting your supplement routine. Here's a quick tip. If you're already taking calcium for your bones, make sure you're also getting enough vitamin D. Without it, your body can't absorb the calcium properly, and you're not getting the full benefit. It's like trying to build a house without the right tools. Vitamin D is the tool that helps calcium do its job. And don't forget about lifestyle. Even small changes can help boost your vitamin D naturally. Try spending a little time outdoors each day. Just 10 to 30 minutes of midday sun a few times a week can make a difference, depending on your skin tone and location. If you live in a northern climate or have limited sun exposure, consider adjusting your diet or talking to your doctor about supplements during the winter months. To wrap things up, let's go back to that original question. Is vitamin D really necessary? For older adults, the answer's a resounding yes. It's not just about bones, it's about energy, immunity, mood, and long-term resilience. Whether you get it from sunlight, food, or supplements, keeping your levels in check is one of the smartest things you can do for your overall health and well-being. It's a small step that can have a big impact. Thanks for tuning in to Datdangdoctor. If you found this video helpful, give it a thumbs up, subscribe, and share it with someone who might be wondering the same thing. Drop your questions or experiences in the comments. I read every one, and let me know what senior health topic you want to tackle next. We're building a community here, and your voice matters.